All right. So good morning, good evening. Thank you for the opportunity to speak at this event for the Cohort 2022. My name is Dr. Rael Mutai. I'm a public health practitioner and a medical doctor. I work for Liverpool School of Tropical Medicine based out of Nairobi. I'm a regional technical advisor for Kenya and Tanzania. My project, let me tell you more about my project, the Leadership Journey Project. The title of my project is Provision of Comprehensive Sexual Reproductive Health and Rights, looking at specifically at the inclusion of the comprehensive SRHR package within the UHC benefit package. This project is informed by the fact that UHC lays the foundation for promoting and attaining the highest standard of health, including sexual reproductive health. We find that sexual and reproductive health and rights are an essential element of UHC as it was agreed in the UHC Political Declaration of 2019. What we find is that the current national momentum, not just in Kenya, but across the region, provides an opportunity because governments have committed to provide UHC in the coming years, and therefore including SRHR services within the UHC benefit package in the pooled health financing program and financial protection schemes is going to be quite beneficial for the people of Kenya. And what we also know is that assessments done in sub-Saharan Africa, especially in 2019, show that most countries only provide up to 9 of the 9 bundles of comprehensive SRHR services. How was this short study undertaken? The methodology entailed reviewing the government policy and strategy documents with regard to UHC, more so the policy and the draft UHC essential benefit package, talking to key stakeholders and drawing comparisons between the recommended 9 bundles and what is provided. And the conclusion is that the country has made many initiatives and progress towards UHC, but there are still notable gaps. What are some of the key findings? Outputs and outcomes that I found as I went through these documents is that one, the UHC benefit, essential benefit package has clearly provided for preventive, promotive, and curative services. Secondly, Kenya as a country, in looking at those documents, provides 6 out of the 9 essential SRH bundles, but some benefits are not comprehensively covered, more so adolescent sexual reproductive health services, infertility, menstrual health management, and abortion care. What are the expected outcomes of this study is that this study, through evidence generation, will support advocacy for inclusion of SRHR services in the funded UHC benefit package, and hopefully in the long term, we shall have all the 9 bundles provided, perhaps as part of the movement towards this DG3. Some of the solutions and challenges encountered is that one, as far as solutions are concerned, we appreciate that generating evidence to support policy is critical, and therefore it was necessary to analyze the status versus what is recommended. Secondly, advocacy for inclusion of missing elements of the SRH package remains critical, and there is need to strengthen leadership and governance for UHC. The opportunities, the challenges include a narrow approach to SRHR currently with a focus on MNH, and the fact that implementation of UHC is a progressive process, meaning the benefits will be experienced much later. But there is opportunity to leverage the provisions of the Kenya Kwanza Manifesto for increased funding towards better RMNCH outcomes. In conclusion, then, my closing message is that after going through the leadership journey, which has really been an interesting journey and very insightful, is that I gained enough self-awareness to know what actions support the things that I view as important and how my actions impact my teams. I underwent internal validation of my leadership capabilities, regardless of career trajectory. That is total leadership approach. And also throughout the journey, I realized the value of allies, the value of having connections beyond your immediate circle for progression and for support. And finally, is that I'm committed to transform my current role models to sponsors or advocates, and more so to mentor young colleagues to figure out more so their career paths earlier on in life. Thank you.